This video demonstrates the complete process of patient preparation and anesthesia induction before surgery. At the beginning, the patient's preoperative profile was prepared carefully. All vital signs, including blood pressure, pulse, and oxygen saturation, were checked and recorded. The intravenous line was secured, and all emergency equipment was kept ready. Once the patient was fully prepared, anesthesia induction began. The first injection administered was propofol, which is an intravenous anesthetic agent used to induce sleep and loss of consciousness before surgery. The dose was given slowly through the cannula while monitoring the patient's vital signs. After the patient became unconscious, the second injection, a muscle relaxant, was administered to facilitate endotracheal intubation and ensure complete muscle relaxation. Following this, oxygen was provided through a face mask for about 3 minutes, ensuring that the patient maintained adequate oxygen saturation during the induction period. Next, the endotracheal tube was gently passed through the mouth and into the trachea, a process known as endotracheal intubation. The placement of the tube was confirmed by observing chest rise and checking for proper air entry on both sides. After confirmation, the tube was secured using strapping or sticking tape to prevent accidental displacement during surgery. The patient was then connected to the anesthesia circuit and mechanical ventilation was started. Throughout the procedure, continuous monitoring of heart rate, oxygen level, and blood pressure was maintained to ensure the patient's safety. This entire process demonstrates the step-by-step preparation and induction of general anesthesia, highlighting the importance of precision, sterile technique, and patient monitoring in every surgical case. After the endotracheal tube was successfully passed and secured with strapping, the patient was fully stabilized on anesthesia. Continuous monitoring of oxygen saturation, heart rate, and blood pressure was maintained throughout. Next, the surgeon and assisting staff prepared for the surgical procedure. The operating team followed strict sterile protocols. The surgeon performed proper hand scrubbing using antiseptic solution, then wore a sterile gown, mask, gloves, and cap to maintain aseptic conditions. Meanwhile, the patient's abdominal area, specifically the right lower quadrant, was sterilized using povidone iodine, betadine solution. The antiseptic was applied thoroughly in circular motions, starting from the incision site and moving outward to ensure complete sterilization of the operative field. After the preparation, sterile drapes and towels were placed around the surgical site, exposing only the area where the incision was to be made. This step helped create a sterile zone and prevented contamination during the operation. Once everything was ready, the surgeon made a small incision in the lower right abdomen. The layers of skin and muscle were carefully separated to expose the appendix. With great skill and precision, the surgeon identified the inflamed appendix, clamped it, and carefully removed it, completing a successful appendectomy. Bleeding was controlled efficiently, and the surgical area was irrigated and cleaned. The incision was then closed layer by layer using sutures. The operation was completed successfully and smoothly, without any complications. Throughout the procedure, the anesthesia team continued to monitor the patient's vital signs to ensure complete safety. After the completion of the appendectomy, the surgical team carefully transitioned the patient into the recovery phase. The operation had been successfully completed, the appendix was removed without complications, and hemodynamic stability was maintained throughout the procedure. Now it was time to bring the patient safely out of anesthesia and ensure a smooth recovery. The anesthesia team remained fully alert as the surgeon completed the final suturing of the incision site. The surgical field was cleaned with sterile saline, and a final dressing was applied. Throughout this period, continued without interruption. Immediate post-operation phase. As soon as the surgical team confirmed hemostasis and closure, the anesthetist began the post-anesthesia management. The patient remained under the effect of general anesthesia, with the endotracheal tube still in place and connected to